There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, are the spices by Mrs. Dash really helpful for high blood pressure patients? Answer by Brett Scher. Sometimes the Dash diet can get confused with Mrs. Dash spices. They are not the same. Focusing on nutrition high in real foods, predominantly veggies, high in potassium and without processed foods and added sugar can be beneficial for high blood pressure, as was shown in the Dash diet trials. But for someone who is sensitive to sodium, it is a good idea to find non-sodium based spices to use. I agree, however, with the prior answer that at BP that high, the general recommendation is to start medication. The hope would be that the med could be stopped in the future with improved lifestyle interventions, but bringing down the BP should be a more urgent priority at that level. Answer by David Halifax. Yes. That's because for many people this can be a great way to reduce sodium intake, which in turn can help reduce blood pressure. There's also another secondary reason. The combination of ingredients in the mix may also have health benefits. Take Mrs. Dash Original Blend 2, for example. It contains garlic, which multiple studies suggest can cause a notable decrease in blood pressure. These benefits are secondary because the claims about garlic benefits are for a 10% reduction in blood pressure. To get a 200/130 reading down to 120/80, a 40% reduction would be required. Footnotes: 1. Effects on blood pressure at reduced dietary sodium and the dietary approaches to stop hypertension, DASH, Diet Nay. 2. Mrs. Dash Original Blend. 3. Garlic. Scientific review on usage, dosage, side effects. Answer by Nathan Green. At those levels, your father needs medication. In the best case, cutting salt drastically will only lower his blood pressure by around 10 millimeters Hg. There's no way around it. You have to start with medication. Once you have things under control, there are dietary and lifestyle changes you can make. Optimize circadian rhythms. Get lots of sunlight in the morning and avoid artificial light at night. Eat breakfast in the morning and don't eat after dark. Get plenty of sleep. Experiment with a low-carbohydrate diet or a fasting protocol. All of these options have at least some experimental evidence to show that they might be helpful.